Be careful here. There are two big vessels, so it can bruise.
So deep to the bone?
Yes.
Touching the wound.
Yes, this is a painful area. No, okay. And sometimes you can go even in a traditional way. And then you model it a little bit with your fingers. Pardon? I mean, above?
And below your neck, then here.
Where you injecting now? One above and one below?
Okay. So you make your patient sit. Look, sit. You see where the jowling is, where the relaxation is. You inject forward in front of it, and then if you want, you can inject this area just to create the definition of the mandibular line. Okay, come down. But, and I usually prefer, and you can use this technique just to see where the wrinkle is. Then we can use this SR to refine a little bit this area. Do you use microcannulas here? Yes.
Yes.
How many of you have been using microcannulas? Okay, I think it's important when you use microcannulas to use microcannulas as surgical instruments. So if you're going to reuse the same cannula, because they don't, it's important to make a clean sterilization with a surgical antiseptic, chlorhexidine or betadine or whatever you prefer. But okay. So I'm just trying to make it even. This type of treatment, of course, it's okay in her face, but she has a very good subcutaneous layer. She has little or no fat depletion, so we don't want to inject that much. We don't want to change that much. And you see, I'm trying to work in the pre-jowl sulcus just to release all the depressions. And since we have a little bit left, we don't want to throw it. Just give me the blue. We can refine a little bit more from this side, working on reverse. Just to lift again in the malar area in a more superficial plane in comparison to what I did before, and from here you can work a little bit in the nasolabial fold. So be careful when you pinch the skin. She has some small capillaries, so sometimes it can bleed. So I think having magnification lenses it's useful. She has a very good subcutaneous tissue. Sometimes you feel patients that are very hard to work, fibrous, especially if they had some previous filler, like some biostimulatory fillers, I mean radius and polylactic acid, that create a lot of fibrosis. And if you're experienced with fat graft, the technique of using the microcannula is more or less the same. In this case, you only choose one layer and you work in one layer. With fat graft, you sometimes you work in different layers, but the technique is the same. Okay, just 1 second. So you can. Okay, any questions? Okay.